Hi everyone, hope you are doing well. Thanks for watching this video. So my name is Evelyn Bigini. I'm a registered nurse currently in Rwanda. So I went to Pitt for my undergrad in nursing and a certificate in global health and graduated in 2020 at the start of the pandemic. And then last year I was a Fulbright student in the Netherlands to study global health, and then now I'm in Rwanda. I'm currently in Kigali, the capital, but I'm usually in Butaro, which is a more rural area. And I'm studying again another master's, but this is global health delivery, so it's a bit more practical, a bit different. But anyway, I just wanted to talk to you a little bit about my experiences. Thanks, Elaine, for inviting me, and I'm sorry I can't be there live for any panel or anything. I'm currently in field school. We just started today, which is also why I'm a little, because we've been moving around. So we'll be going all over Rwanda, looking at, different ecosystem health things. But anyway, I'll get into that. So I can talk a little bit about how I got to where I am. And anytime, feel free to reach out to me if you have more questions. Elaine has my email. I'm very happy to, set up a time to talk with people this week, which is, the last week of March, and right at the beginning of April, I'm, traveling for field school. But after that, please feel free to email me, and I'm happy to, set up a Zoom call with you. It would be really great to, learn about anyone who's listening. So anyway, my name is Evelyn. I'm from New Jersey originally, and then studied at Pitt for 4 years for my nursing degree. I definitely enjoyed nursing school, but I realized that I was more interested in community health and public health, global health, more than like acute care. So then I applied for different national scholarships because I really wanted to study abroad and get more, broad perspectives about health, more than just like a strictly biomedical model. So I applied, to Fulbright and some other national scholarships. The Honors College office is really, really helpful. So thanks, Alicia. If Alicia's listening, she was, instrumental and aided too in getting me where I am. But anyway, so then I studied in the Netherlands last year, studied global health and learned more about ecosystem health because my my thesis supervisor, she was involved in ecosystem health, and my thesis was about community gardens in New York City and people's perceptions about them and how they contributed to food security. But a specific lens I wanted to focus on was social justice, and it actually turned out that in the findings that people we're more interested in food sovereignty than food security, which I think is an important point, especially because the community gardens don't, produce a ton of food, but it's more the act of growing food, like cultural ecosystem services, which is, an interesting topic to look into. And then I had been following Partners in Health for a while in global health. I think you all know, the late Paul Farmer. He spent his last weeks with us, so we were very, very grateful to have that time with him, and sending peace and love to his family and for all affected by the loss. Hopefully we can use it to move forward. But anyway, so I've been in Rwanda since January, but I started in August my master's in global health delivery program. It started online, now it's in person, and I'm specifically in the One Health track. So One Health focuses on the intersections and interconnections between humans, animals, and the environment, hence why I'm on field school right now. We're doing, field visits. So I don't really know, where to start, but I hope that some of this is, this talk is helpful to you all. It's a bit hard just talking to my computer screen in a hotel room, figuring out, what to deliver and everything. But hopefully, again, some of this information you find helpful. But really, I think a lot of getting to where you are is just being in the right place at the right time. I think a lot of it is kind of serendipity. in how, who you meet, where you apply, where you get in, like financially wise. I mean, I wasn't going to do this current program in Rwanda because of financial reasons. But actually reaching out to the university, they were really, really helpful and actually, decreased the cost, which was, very, very kind. But yeah, I think like looking for opportunities, always just being open-minded to different opportunities, to different things, and trying to diversify like what you're doing. You don't have to be, the best at one thing, or if you do want to be the best at one thing, that's awesome. But for me, I've always wanted to do a lot of different things. So being open to different opportunities, like doing different things, I think anytime you switch like career paths, I mean, I haven't really worked, but if you've like switched, focuses, you also bring a lot from your past experiences. And I think that that's something also to highlight when applying for different scholarships or academic programs or jobs. But anyway, so in addition to my studies, Elaine asked me to talk about my recent fellowship with the Association of Nurses for Healthy Environments. So I saw that they had posted something online about this fellowship. It's a health equity and anti-racism fellowship. So it was online. Every month we had some activities to do. We listened to panel speakers and kind of learned about anti-racism and also environmental, justice connections in nursing. And that's something that I'm pretty passionate about, especially in the U.S., the environmental injustices, globally too. But yeah, so then in the Netherlands, I also volunteered with an organization called Refugee Project Maastricht. I was working with the kids team. So we each week went to the refugee center and did some programs with kids. I think reflexivity and thinking about, our positionality is really important, especially in global health, and especially if, intersectionality too, like, of course, but being, attending an American institution and thinking about global health and, neocolonialism and everything like that. So, and I think Pitt is doing that, but certainly always important to focus on it. I can suggest a book that I recently read by a UGHE author. His name's Eugene Richardson. He wrote Epidemic Illusions on Coloniality in Global Public Health. So I suggest people read that and other structural kind of novels. But let's see. I can talk a bit about kind of how I went from Pitt to where I am now. So at Pitt, I would certainly say take advantage of the opportunities because there are a lot of opportunities at Pitt. So I was involved in the public health school a bit, did the Bridging the Gaps program. So for anyone who is in their last year or going into their last year of some sort of medical science education, you can apply to do Bridging the Gaps. It was an incredible program. I'm very thankful for the instructors I had, for the partnerships, for what I learned. And I think this also goes along with the point of diversifying kind of what you do. And I haven't worked full time. I've done part-time jobs along with school. I've done volunteering along with school, multiple part-time jobs at once. But what I can say from that is even just doing some things outside of school really helps. It helps, I think, your mental health, at least for me, to get outside of the classroom or outside of my computer a bit. And then also it helps with, putting things on your resume. So you went to school, but you also work part-time as a research assistant, or, you went to school and you also volunteered with an organization. And again, I think it's important to think about your positionality. That's something that I've thought a lot about over the past 2 years, especially with working with people who are, asylum seekers, and then also being an American in Rwanda studying global health. So I think, it's really important. There may not be an answer, as I was once told, but it's always important to reflect and to continue doing that. So for the next steps for me, I do actually miss clinical a bit. I don't miss actually a bunch of things about clinical, but I really miss talking to people. And that's something that I've also learned by doing something, outside of my schoolwork. I have been really fortunate to be able to go to the Butaro District Hospital and go around with the nurses that work there, or a nurse and a physician that work there, just for a couple hours, in accumulation, like less than 10 so far. But even through that, I was able to recognize that I do miss, being there for people. And although I don't speak Kinyarwanda, which is, what most Rwandans speak, I think just being there for people and, holding someone's hand has meant a lot to me and my family when people have been ill, or just, going through a rough time. And so that's something that I miss. So I think now I'm looking to work in mental health for maybe a year, and then be a mental health nurse practitioner, and then do my PhD after. So that's, a lot of schooling, but thankfully I'm stable in where I'm at, and I like school. So I'm hoping to work in academia, which I've realized after being in school for many years. But yeah, so for my PhD, I'm hoping to do something about mental health, climate, and migration, because those are kind of intersections that have led me to where I'm at, through courses, readings, working with people, just life experiences. And then a little bit about me personally. Sorry, I'm jumping around. I'm looking at my notes, but I really like swimming. I'm actually missing swimming right now. There's a swimming pool downstairs where we're staying, but I'm doing this video. So obviously I, care a lot about you all because I'm missing my swimming time. I enjoy walking. I enjoy being outside in the sun. The One Health students in our Masters of Global Health delivery cohort are referred to as kind of like the hippies. So there's a group of us that definitely, we're always sitting near the windows with the windows open, going outside. Like there's some of us that even go outside in the rain, like purposefully, not just because it's boring in Pittsburgh. I also enjoy reading, and that's kind of shaped who I am and where I've gotten in my life. Like I think some specific books that you read can really hit home with you. So Valeria Luiselli is my favorite author. I'm currently reading her. I've read a couple of her books, but I'm currently reading Lost Children's Archive. I can really suggest it, to anyone. And then I really like talking with people, engaging with people. Usually I don't like, being on the screen, but the thought that this video, will hopefully engage people, would be, really nice. And I'm looking forward to hearing from you. And hopefully, it's more than just a video. I guess for advice, something that's been successful for me in the past is just reaching out to people through email. If you see someone who's doing the type of work you're doing, like reach out to them. People love talking about themselves. Hence, also I'm doing this right now. But reach out to people. Like when I've done that in the past, people have been pretty responsive. And if they're not, then that also maybe says a bit about them. But if you're asking people like, hey, I'm really interested in your work, like I'm interested in what you do, I'm hoping to kind of tailor my path. I think a lot of people are pretty responsive, so that's actually what I'm hoping to do soon for, PhD or this like mental health nurse practitioner role. What else? Yeah, I think like volunteering or doing, if you, have the luxury, or any type of work experience, I think it's good to put down. So if you are working to get yourself through school, like that's a lot. And I think that's something that maybe people would be receptive to hear. I mean, it shows that you're a very hard worker, but anytime, you're working, but also make sure that you have balance for your mental health too. This is something that, I've learned over time. Like there's a time when to put the computer down. And it's like hard, and it's hard to get there. And especially not everyone has the luxury to do that, which I hope, will change. I think that's, needs to change. And then what else? Oh, dealing with uncertainty. So I'm not someone who has always done well with uncertainty, but I think over time you develop, I don't know, kind of, it's like I've much more go with the flow than I've been in the past. I think maybe also because of the pandemic, like things just are always changing, as we know, as we've seen over the last years. As you know, I'm sure whoever's listening to this knows. And so trying to give yourself grace, give the people around you grace, I think is really important. So anyway, that's a bit about me. Again, future plans, hopefully mental health nurse practitioner, PhD, work in academia, like a global health and clinical setting, because then, maybe I don't know where, like clinical wise, but in mental health, and because then I can do a bit of everything, which I miss. So, clinical education, maybe lecturing, and also research. So anyway, thanks for listening to this. Hopefully I didn't blabber on too long, but if you have any questions, please feel free to reach out to Elaine, and she will get you in touch with me. It was a pleasure, meeting you all. Well, hopefully I'll meet you soon. Thanks so much for listening, and have a good rest of your day. Thanks.